When treating the upper dorsal or the cervical on a table, it's important to know what is going to be the effect of a cervical piece on the cervical tension or on the cephalad arc of tension. So a lot of people think if I bend, basically if I flex the headpiece, I'm going to create a tension in the neck. In reality, there are different types of headpiece. Here we have an actual headpiece, so the actual is right there. And observe how my neck is right now with quite a bit of cervical lordosis. If I bend that table quite a bit, let's say probably around 45 degrees, at 30 to 45 degrees right here, look, my cervical curvature is still there. So the head flexion, basically, for 35-45 degree flexion of the headpiece, I don't have a flattening of the cervical lordosis, especially if the headpiece is on an axial type of system. Now, if that headpiece was dropping down, I would have much more flexion of the neck. So why? And we would call that a plate headpiece that drops down, and there in this case there is a column right here. Few tables are built like that. Most often right now are built with an actual headpiece. So to increase my cervical tension, I can slightly ask the patient to tuck his chin in, and then I will have a better cervical tension at that level. And the other thing that I can do is ask the patient to put both arms, and that also will add to the tension at that level. But the cervical headpiece basically will increase moderately the tension. In a case of a treatment prone, where we treat with a spinous contact, it will be used, and because the flexion of the headpiece does not allow for full tension, we will be able to treat those patients only with a 45-degree head rotation. And the same technique will be used as before, but instead to have a 90-degree rotation, like before, we will have a 45-degree rotation and a slight tilt of the headpiece. So we will have flexion of the head, small rotation of the head, and that will allow us to have the perfect tension for the cephalad arc of tension for a prone technique using the thumb. So let's see how it works. I will take a contact directly on the spinous with the thumb, same thing. And this time, I will gently rotate the head 35 to 45 degrees, create a little traction, and feel the end feel. And the thrust will be there at the end, medial, lateral to medial, with a distraction at the same time. Now, the perfect end feel, we will have to play with the headpiece. And just raising it up will change the hand feel. So do not hesitate to use that headpiece, move it slightly to feel the perfect hard hand feel. And for the lumbar, we will use a technique that we used before. Raising up the pelvis will increase the lumbar lordosis and will allow us basically to treat with a stronger caudal arc of tension.